I'm Dr. F.Weiner from the Aesthetic Clinique. We're located between Panama City and Destin along the Panhandle and the Emerald Coast. And I wanted to introduce to you today a remarkable new procedure called the body jet, which is water-assisted liposuction. Forget all your predetermined thoughts about liposuction. This is completely different. This is done under local anesthesia, and the trauma to the tissues is a lot less than your typical liposuction. What it is, it uses water when you're underneath the skin to dissect the fat from its surrounding tissues and gently suction it up. So the trauma to the tissues is less, the downtime is less, the bruising is less, the bleeding is less, discomfort is less. So most of my patients have zero or very little preoperative medication to sedate them. And most afterwards don't even require pain medicine. So I'm not going to say 100%, about 90% don't require any of this medication. The procedure also is beneficial because it collects the fat in a very non-traumatic fashion. So 90% viability of this fat. Other procedures that collect the fat are usually in the 40 percentile range. So this is so atraumatic that you get 90%. Then you put this fat and you put it into the face, underneath the eyes, into the nose, in the temples, marionette, nasolabials, but you can also put it into the breasts, the buttocks, and particularly popular is putting it into the hands. So what I want to do today is demonstrate the procedure, see the ease of the procedure, see how fast it takes, and then show you someone that's a week out and get their experience. So come on in and let's talk to Janice. Hello Janice, today you're going to have your body jet on your outer thighs, is that right?
Yes sir.
And you have done this before. You did it on your belly about 3 or 4 months ago and you enjoyed the results, correct?
Yes.
And to tell us a little bit about your experience when you had it last time.
Very easy, minimal downtime. Actually there was no downtime. I got up and assisted you with the next patient. Very little bruising, very little swelling. There was no discomfort after the treatment.
So this time we're going to go for your outer thighs, and then we're going to take that fat and we're going to help you with your face a little bit, put it into your nasolabials and marionette areas. And we're in the treatment room for the body jet, and I just wanted to go over a couple things. Here's the infuser. This is what instills the lidocaine mixture. And what you'll see is it has a gentle spray that sprays the lidocaine out underneath the skin. It's almost like a windshield wiper spray. And what that spray does is it spreads the lidocaine underneath the skin. And typically when this is done with tumescent anesthesia, which is the other way to do this under local, you infuse it underneath the skin and you infuse several liters of fluid usually to do this. And then it sits there for several minutes. Well, you'll see when I do this is that I just infuse this 150 cc's and then go right ahead and start doing the procedure. What you'll notice during the procedure is that the fat and fluid that is sprayed will go through this tubing and be collected. The fat will be collected in what's called the lipo collector over here. Doing very well. And we're just putting the medicine in here. And this is numbing her up. She has taken no pain medicine, no sedation. The benefit of doing this versus tumescent anesthesia is that I have infused only 100, 125 cc's. So I get to see the contour of her leg a lot better than if it's really swollen up from the tumescent. And the fat's already coming out. You see it going up the tubing, and then we're collecting it. You okay, Janice?
Yep.
And we got a good portion of fat there in the lipo collector. And they go kind of slow. I don't know if you guys are familiar with the other techniques of liposuction, but you see the doctor moving the cannula 5 times as fast as I'm doing. And that can't be good for the tissues, it can't be good for the post-operative care. I'm just doing it nice and gentle here, and letting the water do the work for me. Again, all local, no sedation, no pain medication. She's not feeling.
This is the fluid that was removed. The lipo collector has the fat in it, but you can see that the fluid was very, very, very little blood in it.
Okay, I just wanted to show what it looks like immediately afterwards. Again, in your typical liposuction fashion, it's extremely swollen and it looks all bruised and bloody drainage and so forth. Right here we have a little paleness to the area because that's the epinephrine, which helps control both the lidocaine and the bleeding. But you see, it's really, it's not tender at all, but there's no swelling. There's a little bit of swelling, but there's no bruising or bleeding from the area. It's what they call liquid gold because now you can use it any way you want to use it, and it's pure fat. That's the huge benefit of using the water-assisted lipo, is because the fat you get you don't have to spin it down, you don't have to put it in a centrifuge, you just go with it. Spinning it down, filtering it, and so forth kills the fat cells, and this keeps them all viable. So you get a 90% viability doing it this way. All right, Janice, how you doing?
Good.
Good. We're about 10 minutes after you had your procedure, and you've already been walking around, go to the restroom. Now we're ready to do the fat grafting. Any questions about that?
No.
Okay, what we're doing here, she's all numb right now, Janice is, and what we're going to do is we're going to first make a little incisions to enter the skin. But we're going to end up putting fat in the nasal labials, the chin area, and the marionettes, which are down here. Turn up the corners of the mouth a little bit too. I wanted to re-emphasize that not only does the fat help with the contouring of her face, but you're going to get the stem cells that are in fat, fat's very rich with stem cells. And you're going to get that rejuvenating the skin and helping make the whole face, actually the area where we injected, more rejuvenated. And that's a long process. That takes weeks to months to years to actually fully appreciate. Well, Janice, you're about 2.5 weeks from the body jet procedure, and tell me a little bit about your recovery.
There wasn't much recovery. It was actually very simple. I was back to work the next day, continued to walk my dogs. I live on the 2nd floor of an apartment complex, climbed 16 stairs every day, several times a day.
Yeah.
Took about 2 weeks for the swelling to go down. But now my clothes don't fit, so that's a problem.
I'm very pleased with your results as well.
Yes.
And I've seen your thighs, and they look like they healed up perfectly, very smooth. On another note, how did you like the fat transfer?
I loved it. I've always had the marionette lines right here, and great results. Don't have those anymore, and I didn't get any bruising. I've gotten filler there in the past and always had a small bruise or a little bit of a bruise. I didn't get any bruising from the fat transfer, which was very nice.
I think the way I recommend the fat is for people who have had multiple injections with filler and just are kind of fatigued, tired of getting the filler, or they need 20, 30 cc's and filler is just not even a viable option.
Yeah.
And that now it just feels like part of you, and even
very soft, very natural.
Very natural feeling. It looks great. It's very natural. I want to stress again that that fat transfer is now becoming the big talk of all these conferences. It's been around for 20, 30 years, but only now has it become a viable alternative. So we look forward to other people seeing this video and you even helping out on and giving your firsthand knowledge of how the procedure went. it's very helpful to the patients. In conclusion, I hope this gave you a good perspective of how the body jet procedure goes from start to finish. You see it's a fairly easy procedure, and I hope it eliminates all your preconceived ideas about prior liposuction. The greatest thing as well is getting that fat and retransferring it into the face and hands. If you have any questions, please give us a call at 850-622-1214 or visit our website at www.theclinique.net. Thanks for viewing this video.